I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
Today we're talking about natural treatments for pain management. And this is a big issue. I know I'm the only chiropractor in my state that's board certified in pain management, as far as I know. I'm also board certified in chiropractic, orthopedics, nutrition. And so pain management is a big part of our practice. So many patients come to us from all over the world because they want to try to find a better approach than what they've been doing. Now, I'm not against drugs. I'm not against surgery. I'm perfectly fine with that. But what I want you to consider is maybe there's an alternative. And that's what we're going to talk about. Perhaps an alternative that can solve a lot of problems. It save you money, save you time, save spinal degeneration. Insurance companies are loving these alternatives that we're offering. And 20 years ago, I really didn't get a lot of referrals from orthopedists, neurologists, neurosurgeons. Now I'm bombarded with referrals because the world is changing. If you have insurance, you understand that insurance stinks. Let's call it what it is. And so people are looking for alternative treatments. When insurance covered everything, you just go and do whatever you wanted. But now you have to come out of pocket. And this is important because now you have to decide where to spend your dollar. And you decide that this dollar is going to be spent at the best, most effective treatment. So we're going to talk about alternatives. I'm not against surgery again. Sometimes surgery is necessary. A friend of mine, he's a neurosurgeon, and we had dinner the other day, and he said, the biggest problem I have with patients is that they expect to come to me and I do surgery on them and it resolves their pain. He says, that's not the case. Many times we do the surgery to try to control the pain. It doesn't get the pain gone, and then patients complain. I came in, you did surgery, I paid all this money, and I didn't get better. Well, that's what he said. He says that's why he doesn't like doing surgery unless he absolutely has to, and he prefers using alternative methods. And that's what we're going to talk about today. So narcotic painkillers are really the driving force between substance abuse and so many people dying. I have a friend of mine, he's a dentist, and his wife, we were talking one day, and we just getting to know each other, and he said, I'm a widower. And I said, oh, gosh, I'm sorry. He said, my wife was in a car accident. He said, I wish I'd met you sooner. My wife was in a car accident, and she got hooked on opioids. And when the doctor said, I can't give you any more opioids, she went and turned to heroin. She went on the streets and started buying heroin, and she died. He says, and I just wish that I had known about alternative treatment sooner because I would have done everything I possibly could to keep her alive and get her off those opioids. Now, you don't know you're going to become an addict. That's the problem, because some people's brains are different than others. So I might be able to take opioids and go, okay, I took them for a few days, that's great, it's under control, and I'm good. You or someone else might take them, and it stimulates the dopamine receptor sites in the brain, the nucleus accumbens and other parts of the brain, and you become an addict. And so you don't know what's going to happen until it happens, and once it happens, then it's pretty hard to reverse. So I want you to consider all the alternatives possible. So I'm going to strongly suggest you exhaust all your other options before you go into narcotic therapy. Not against it if you need it, but I want you to consider that. The health risks associated with the drugs are pretty great, and the addiction, it's a real concern. So let's talk about some of the best strategies that I know of to deal with pain management. If you're in pain, try these first, even before thinking about prescription medications. So first one, I want you to eliminate grains and sugars from your diet. Now, if you've listened to my show before, you know I've done this 1,000 times. Guys, you got to give up the sugar. Sugar, sugar, sugar. Sugar raises your insulin levels. And what happens is you eat sugar, the pancreas releases insulin, the insulin goes into the cells and acts like a key. It opens up the cell and allows sugar in. So that's how insulin works. If you eat a lot of sugar, you release a lot of insulin. Insulin is related to inflammation. A lot of inflammation occurs when you have a lot of insulin. It also releases something called leptin. Leptin is a chemical that's released in your stomach and in your fat cells and goes up into the hypothalamus in your brain and makes you feel full. So if you release a lot of leptin, the cells in your brain, the hypothalamus, become leptin resistant. So what that means is you're releasing all this leptin. The hypothalamus says, listen, I don't even know if you're telling me the truth or not. It's like the boy that cried wolf. And the hypothalamus says, I don't believe you. I don't believe that there's food in there that you're full, and you become leptin resistant. And this is one of the reasons why people that are overweight have such a tough time eating less. I used to be overweight, full confession, when I was a child. And so what happens is you eat a lot of food, the stomach releases leptin, and you produce fat cells. Fat releases leptin. Goes into the hypothalamus. Hypothalamus says you're full. After a while, the hypothalamus doesn't listen to you anymore, and then you want to keep eating. And when you keep eating, you put on weight. And fat is inflammatory, and fat puts strain on the joints, which causes more pain. So there's a chemical and a physical reaction when someone's overweight. And I know this, again, because I used to be overweight. So we got to be able to control that. So by cutting out the sugars and the grains, people say, well, I'm not eating sugar, but I'm eating bread. Well, that's sugar. I'm eating a lot of rice. Well, that's sugar. So breads, sugars and grains, cut them out. Your body produces less leptin, less insulin, and now the cells can essentially reboot themselves. And so you don't have to eat as much. And in the process, you bring down the inflammatory reaction. And that's the key. We got to get that inflammation down, because the inflammation is the thing that causes the pain. So is it hard? Yeah, it is. But the first 3 days are the toughest. And whenever I have patients come in, I say, listen, guys, you got to get off your sugar, your breads, cookies, cakes, donuts, and pastas. The first day is rough. The second day is really rough. The third day, oh my gosh, I have to have something sweet. By the fourth day, it's done. So if you can stick it out for 4 days, I promise you, by the fourth day, it's going to get so much easier. You have to get high-quality omega-3 fatty acids in your body. Omega-3 fatty acids are precursors to something called prostaglandins. Prostaglandins are chemicals that are produced in your adrenal glands. Now, what are your adrenal glands? You have your kidney, and on top of the kidney is a little walnut-shaped organ called the adrenal gland. Now, if I slice the adrenal gland open, I've done this, you slice open the adrenal gland, it has 3 layers. One layer produces adrenaline to give you energy. One layer produces your sex hormones, testosterone, estrogen, progesterone, and the third layer produces prostaglandins. Prostaglandins control inflammation. You need the omega-3 fatty acids to produce the prostaglandins to control the inflammation. Now, if you're a meat eater, you're probably getting some omega-3 fatty acids. And some of you are thinking, but Dr. Joe, I eat fish. Fish are loaded with omega-3 fatty acids. I'm fine. 2 things to consider. Number 1, if it's a farm-raised fish, chances are the omega-3s are almost 0, if not 0. Only the wild-caught fish have omega-3s in it. Number 2, when you cook the fish, the heat destroys the omega-3s. So people think they're eating fish to get omega-3 fatty acids. Wrong answer. It's not going to work. Okay? If you're a vegan, like myself, or a vegetarian, you're probably not going to get a lot of omega-3 fatty acids either. That's why I recommend, one of the supplements I recommend for everyone, especially if you're in a pain management issue, in a pain management situation, you want to take omega-3 fatty acid supplements. There's 3 types. Number 1, fish oil. Not my favorite. Fish oil, many times it's contaminated with mercury and other chemicals. If it's a farm-raised fish, chances are there's not a lot of omega-3s anyway. If it's wild-caught fish, you run the risk of contamination. And the body has to convert the fish oil omega-3s into what we call a phospholipid form. Phospholipid form is the type that your body utilizes. So fish oil, not the best. Krill, kind of like little shrimp, that's in the phospholipid form. Much less risk of contamination. Much better choice. The best choice is algae. Fish and krill don't make omega-3 fatty acids. Fish and krill get it from eating smaller fish who eat the algae. The algae is the source of the omega-3 fatty acids. So why not cut out the middle fish, or middleman, and go right to the algae? It's the purest form, less contamination. On our website, drjoe.com, we have an algae omega-3 oil. It's the one I take every single day. And it's not only important for pain management, it's also necessary for brain function. So omega-3 fatty acids, absolutely necessary. They're called essential fatty acids. When you hear the word essential fatty acid, essential amino acid, that means your body doesn't produce it itself. It needs to get it from an outside source. We talk about, we did proteins the other day, and there's essential and non-essential amino acids. There's about 10 that are non-essential. That means your body makes themselves. There's 10 or 9, depending who you talk to, that your body needs from an outside source. So the essential omega-3 fatty acids you have to get from an outside source, algae being the best source. And that's on the website, drjoe.com. Chiropractic care. I'm a chiropractor. How could I not do a report on chiropractic care? It's an absolute no-brainer to me when someone has pain that they should consider chiropractic care as their primary source of treatment. I do not, for the life of me, understand why someone in pain wouldn't go to a chiropractor first. It's the least expensive and the most effective. I don't know what else I can say about that. It's the least expensive and the most effective, so why wouldn't you do it? And you want to go to somebody who's good. There are good chiropractors, just like there's good surgeons, and there's good and there's bad. So what I recommend is if you don't come to us, of course, I train all my doctors, so I certainly trust them, ask around. Ask your friends, who do you go to? Who do you trust? Who gets good results? I'm not a big fan of, just looking on the internet and looking at reviews, because only extreme people leave reviews. Most people who are happy don't even leave reviews for restaurants or anything. I'm not just talking about healthcare, but anything. But you can do it. We have good reviews. I'm happy with that. But I don't always trust the reviews. But chiropractic care is relatively safe. The risk of getting hurt in a chiropractic office is extremely low. Is there a risk? There's a risk in crossing the street, yes. The risk is very low. And what chiropractic does, it tries to get to the cause of the problem and not just treat the symptoms. So if we can get to the cause of your healthcare problem, it's a lot easier to get the problem to go away. And I tell every new patient that comes in our office when I meet with them, I'll say, we're going to try to do something no one's ever done before. We're going to try to find out why. And if we can find out why you have neck pain, back pain, shoulder pain, headaches, acid reflux, heartburn, indigestion, digestive issues, then we have a path to go instead of just treating the symptoms. And almost all our patients love that approach, because otherwise they wouldn't be in our office. So chiropractic care is relatively safe. And here's the other thing with chiropractic care. If a bone moves out of place, it hurts, but 90% of your nerves don't feel pain. So you can have a pinched nerve and not know it. The nerves that don't feel pain control the organs. You don't feel your blood pressure, your spleen, your kidneys, your bladder, but they're all controlled by nerves. So with chiropractic care, not only do we work on pain, we can also open up nerves to organs. And that's why so many of our patients come to us without a lot of pain, but actually organ problems, because they listen to this show. And then the third thing that chiropractic care addresses is joint deterioration. If bones are out of alignment, they rub up against each other. And as the joints rub up against each other, they wear out. And that's called osteoarthritis. So if you have osteoarthritis, most of you don't know why, and now you do. If bones are out of alignment, they're rubbing up against each other, the discs wear out or the joint wears out, that's called osteoarthritis. And even people that do stem cells is the new buzzword right now. You can inject the stem cell into a joint, and in many cases it can regenerate the joint. We also use something called prolotherapy, which is injecting like a sugar into the joint, and that irritates the joint and causes it to lay down new cartilage. Both very effective techniques if taken with chiropractic care. Because if the joints are out of alignment and you put a prolotherapy in there or stem cells, it's going to regrow some of the joint, but if the bones are out of alignment, they rub up against each other again. This is why chiropractic care works so well with the other treatments that we're talking about. So that's something you certainly want to consider as a treatment. Acupuncture. People come to me all the time. Dr. Joe, what do you think of acupuncture? Acupuncture is awesome. It works great. But if the bones are out of place pinching the nerves, you're not going to get the full effect. So acupuncture works on stimulating or suppressing the nerve impulses. So acupuncture is great. I've had it done. I get it done often. So I support that 100%. So it's another alternative treatment you can consider before going to the more extreme treatments. Physical therapy, massage, absolutely wonderful. And in many cases, help get to the problem. But if you have bones out of place pinching nerves and you don't put the bones back in place, you're not going to get the full effect. And that's what I want you to consider. Always get to the cause, and then these other things work so much better, including nutrition. Patients come to me and say, Doc, I just want to do nutrition with you. I said, okay, great. We do nutritional workup on them. It's great. And then I come back and say, well, Doc, I still have a little bit of this or that. Great. Now let's go back to what I talked to you about a while ago, getting to the cause of the problem. Ginger. I love ginger, not the woman or the hair. I love the food. And ginger root is great. And what I do is I'll buy a bunch of organic ginger root and I'll peel it. And you can use a spoon to peel it or a peeler. Somebody got to be a great thing. It's a glove that you can wear when you're peeling things so you don't cut your hand, because I would always tear off the little tips of my fingers. So that's just wonderful. I peel the ginger, I put it in a food processor with a little bit of lemon juice, about 1/3 covered with lemon juice, and I puree it. Now when you puree it, you break down all the fibers, because ginger can be very fibrous. So break it down until it's like the consistency of puree, like pizza sauce. And then I put it in an ice cube tray and I freeze it. In my freezer right now, if you went to my house, I have a bag of frozen ginger ice cubes. It's great because you can make tea with it. Very easy to make tea. Just take the ice cube, put it in some hot water, add some stevia to it. You got ginger tea. You can also use it for cooking. So if I want to do some stir fry or something like that, who has ginger sitting around their house? I have it in my freezer. Take it out, throw a little in there. It's great. Ginger is an anti-inflammatory. It works really well as part of a whole treatment plan. And what we're talking about today is natural pain control methods. And we're getting to the cause of the problem, not just treating the symptoms. But we're giving you a plan. Most of you have health insurance, but you don't have a health plan. A plan is a step-by-step action that you're going to take to get to the cause of the problem and fix it. And most people don't have a health care plan. I have insurance, I can go to the doctor, I can get drugs, but that's not getting to the cause. I want you to start thinking about a health care plan. Curcumin, okay, this is a yellow spice that you see in a lot of Indian foods. It makes mustard yellow. It's found in turmeric. Now, study on osteoarthritis patients. They added 200 milligrams of curcumin a day to their treatment plan, and it reduced pain and increased mobility. That's great. However, if you read more studies, the turmeric as a whole, instead of extracting out the curcumin, works even better. That's why I push whole foods, not the store, but how you should eat. The less processed something is, the better it is. Even oils. You know, if I recommend extra virgin olive oil, extra virgin coconut oil, almond oil, avocado oil. Those are great, but they're still processed. So the less processed your food is, the better it's going to be. So instead of taking a curcumin supplement, you can just use a turmeric supplement, or you can actually just sprinkle turmeric on your food. It has a pretty strong flavor, so you might want to be careful with that. We have an extract that we use at our office, and it's super concentrated turmeric, and that's really powerful. So we have that as well, and if you want to get that, you can just call the office and ask for that. We have that available as well. But curcumin is great, and what curcumin does, it blocks the inflammatory pathways, preventing the overproduction of a protein that triggers the swelling and the pain. So it blocks what's happening. Kind of like a CBD oil. I'm going to cover CBD in just a second. How CBD oil works. And CBD is not marijuana, by the way. I'm going to talk about the mechanism on how that all works. Boswellia, also known as frankincense. Remember, right? The Jesus story, they brought frankincense and myrrh. Frankincense is Boswellia. And Boswellia is so valued because it's anti-inflammatory, and it's a wonderful thing you could add to your diet. And it's just a fun fact that Boswellia is frankincense, and you could throw it out at a party someday. Bromelain is found in pineapple. So bromelain is an enzyme, and it helps break down inflammation. And in fact, some surgeons will actually inject bromelain into a swollen disc to eat away and bring down the inflammation. So bromelain is great. Pineapple is awesome. But remember, pineapple has a lot of sugar in it. So you could add it as part of your treatment plan. Again, it's not going to solve all the problems. Cayenne pepper. I'm Italian. I love hot food. I grew up on hot food. I had a cousin. I had an uncle. Uncle Sally, they called him. Big, heavy-set fella. And he would literally cover his food with a coating of red pepper. And as a child, I thought, that's insane. I still think it's insane. But this guy had some tolerance. But he was so overweight. He was an alcoholic. He was so inflamed that I have a feeling that was his body saying, I need this. Help me. And so many times we have these cravings. Sometimes cravings can be good. And I think that was his body trying to go deal with this. I mean, they called him the Buddha. So cayenne pepper is great. You can mix it in with a cream. Now you can buy cayenne cream if you want to. You can purchase it. You can make your own. Take some cayenne pepper, grind it up into a powder, add a little coconut oil to it, rub it on the area. So cayenne pepper, the way it works, it depletes the body's supply of something called substance P. And substance P is a chemical component in the nerve cells that transmits pain to your brain. So the cayenne pepper deletes the chemical that causes you to feel the pain. Yeah, pretty cool, right? How it works. Eating it is great too. Eating is a vasodilator. It opens up your blood vessels and increases circulation to the body. So eating spicy foods is a great way to increase circulation. Also can help lower your blood pressure. Now, there's a supplement on our website, drjoe.com, and it's called Dr. Joe's Nitric Oxide Support. This is a super concentrated form of things that open up your blood vessels. I take it just about every day because as you get past age 40, just around there, what that'll do is your supplies of nitric oxide are depleted. So by taking a supplement, you open up those blood vessels, replacing the supply of nitric oxide, increases circulation to your brain, injured areas, your reproductive organs, nudge, nudge, wink, wink. So nitric oxide is really important as we get older too, and it can lower your blood pressure. If you are on blood pressure medication and you're taking Dr. Joe's nitric oxide support or any nitric oxide support, monitor your blood pressure because the blood pressure might go too low. And we don't want that happening. And then you have to decide, do I give up the supplements and the chiropractic care and a good nutrition, or do I give up my medication? You decide on that. Let's talk about CBD oil, because that's a big buzzword. Everybody's asking me about it all the time. Dr. Joe, what about CBD oil? CBD oil, cannabidiol, is a chemical, and it gets into the body, And we found this recently because we were researching marijuana. And they found that the cells in your body have these cannabinoid receptor sites. Now, I don't like the name cannabinoid because you associate it with cannabis and pot. You have these in your body already. It has nothing to do with marijuana. But they named it cannabinoid system because they found it when they were researching marijuana. So there's over 100 different CBD type chemicals out there, cannabidiols. And what happens is it gets into the body and it blocks an enzyme called FAAH. And FAAH is an enzyme that breaks down chemicals in your body that help reduce pain. Okay? So by blocking the enzyme that breaks down the chemical that reduces the chemical that reduces the pain is alive longer. It has a longer shelf life. And so it's able to work more efficiently. So CBD oil doesn't directly work on the cells. It indirectly works on the cells by blocking the FAAH enzyme from destroying the chemical that helps reduce the pain. Now, people report miracle results with CBD oil. It helps with anxiety and depression and digestive issues and ADD and ADHD and pain and a post-traumatic stress disorder. That's great. But once again, it's not getting to the cause. It's treating the symptom. Now, THC is the chemical that's found in pot. Hemp oil, where we get our CBD oil from, has a very, very little bit of THC. 0.3%, I think it is, or less. So there's full spectrum. CBD oil has a little bit of THC in it. If you are being tested at your job, if you're smoking pot, over time you may test positive. Broad spectrum doesn't have the THC in it, but it doesn't have as many cannabidiols in it, so it may not be as effective. And then there's CBD isolates, which I think are totally useless. So you don't have to worry about those. So if you're going to use the CBD oil, the CBD oral, tinctures, I'm fine with it. But understand, it's only treating the symptom. It's not getting to the cause. Now, if I have a headache, I'm going to take some acetaminophen. That works for me. And then I go get my chiropractic treatments, and I get to the cause of my headaches. So I'm not against you treating the symptoms. Don't only treat the symptoms. That's what I want to get at. And the CBD oil is all the buzz. If you're going to get it, it's got to be organic. It's got to be from a reputable company. I mean, you can buy CBD oil in gas stations now because it's unregulated. It's the wild, wild west out there with CBD oils, folks. So I don't recommend you just randomly pick one. Okay, if you need some advice, I can always give you some advice on CBD oils. But once again, it only treats the symptom. It doesn't get to the cause. So the cause is almost always a malfunctioning nervous system, a malfunctioning digestive system, and a bad diet. Those are the three things you have to address when it comes to pain management. And this is why so many doctors are excited about these shows, because now I'm giving them options that they never even considered. Gee, Dr. Joe, I never considered that a digestive issue can cause pain. Yeah. Let's talk about that for a second. If you've listened to my show before, I talk a lot about this. Your stomach's job is to take proteins and break them into amino acids. The amino acid glutamine, which we need a lot of glutamine in our diet, but not isolated, because it can cause headaches and neurological issues, but glutamine becomes a chemical in your brain called GABA. And GABA suppresses pain naturally. So if you have a glutamine deficiency, you probably have a GABA deficiency, so you're more sensitive to the pain. Why might you have a glutamine deficiency? Your stomach breaks proteins into amino acids. If your stomach is not digesting food properly, you're not breaking the proteins into the amino acids to produce the GABA. So if you have acid reflux, heartburn, burping, gas, bloating, chronic cough, sinus problems, chances are your stomach is pushed up against your diaphragm and you're having the acid reflux. That's telling me you're not breaking down your proteins properly because your stomach isn't doing its job. So in our offices, my doctors are trained by me to actually adjust or pull the stomach down away from the diaphragm. And when we do that, the stomach is able to break proteins down. The good news about that is acid reflux can lead to things like esophageal cancer. Could actually kill you. So it's important to get that stomach fixed, not taking just the medications, because the medications, I've done shows on this before, can prevent you from absorbing calcium, B12, iron, and magnesium. And it shuts down your acid production, so you're not breaking down your proteins properly. So once again, if you have these issues, you might want to come see us so we can go ahead and fix your stomach, because it's really important to get the nervous system, digestive system, and the diet right. So I'm going to have to go to break in just a second. If you have a problem, if you have neck pain, back pain, shoulder pain, numbness, tingling, if you've ever been in a car accident, ever, if the car was damaged, you were damaged, I strongly advise you come see us. In the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. Go to my website, drjoe.com. All the supplements we talked about, by the way, those are on the website, drjoe.com. We have over 1,000 hours of podcasts. This show is on the website. And to make an appointment, just go to drjoe.com. You can do it right online. You can call us, 844-44-DR-JOE, and make an appointment there. Stop suffering needlessly. Because pain is just a symptom. The things we talked about here, pinching nerves to organs, joints wearing out, that's what the long-term effects are. So if you have pain, you have something wrong, I want you to stop suffering. I want you to get well and stay well. So folks, I'm Dr. Joe Esposito. Again, the website, drjoe.com. Catch you next time. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on a WSB Radio app.